Hello, everyone. This is a truncated edition of the Daily Drum on WHUR and Sirius XM, Channel 141. I'm Harold Fisher. It's that time of year again. The flowers are blooming, grass is growing, and for many of you, the pollen is popping. It's causing itchy eyes, sneezing, runny noses, and so much more. Yes, it is allergy season. So how do you know what you're allergic to and what can you do about it? Well, joining me to talk about this is Dr. Nkirika Erikosima, allergist and co-founder of Alpha Allergy and Asthma Associates. Dr. Erikosima, thank you so much for talking to us. I appreciate your time.
Sure. Thank you for having me.
Absolutely. Here are a few fast facts I want to share with our listeners. Now, according to the CDC, about 26% of adults, or about 67 million people, have seasonal allergies in the U.S., and approximately 19% of children, or about 14 million, experience some form of seasonal allergies. Before we kind of get into the nitty-gritty of this, can you share exactly what is an allergy and why do so many people have them when others do not?
Sure. That's a really good question. An allergy really is a type of reaction that the body has to something that is normal in the environment. And essentially what the body is doing is just overreacting to something that should be a normal thing in your environment.
So with that said, why do some people have them and others don't?
We can't necessarily say that we understand why that happens for the most part, but the things that we know contribute to developing allergies are your genetics and your environment. And so some people just have more of a predisposition to becoming an allergic individual just because there is allergy in their genetics. So maybe a parent or a sibling had allergies, and then the environment also plays a role. And the environmental part is the part that isn't all well understood. But we know that when you're in certain environments, you tend to be more likely to develop allergies than in other areas of the world.
So how do you know if you have a seasonal allergy short of being tested? This seems to be the most critical time of the year, but certainly some people have them at other points of the year.
That's true. The honest truth is, without being tested, you can't really be sure that you have seasonal allergies. There are symptoms, and I think most people know that it starts from whether or not you have symptoms. So some people have symptoms and they start to say that they have allergies. However, some people have those same symptoms and their allergy tests are completely negative. So the true way to know if you have allergies is to get tested if you have the symptoms that suggest allergies. And we can talk about some of those symptoms. You mentioned them, when you first started, which are symptoms in the eyes, itchy eyes, watery eyes, puffy eyes for some people, red eyes, in the nose, runny nose, sneezing, mucus drainage down the throat. And so some people just feel like their nose is running in the back and going down to the throat, sneezing frequently, congestion in your nose. For some people, their noses get so stuffy that they can hardly breathe through their nose, or they can't really smell.
I'm raising my hand.
I see your hand there. So it's funny, like some people, their nose is so stuffy that they're like, I can't smell anything during allergy season. Now, allergies can also cause symptoms in the throat. So we think about the eyes and the nose, but a lot of people just say like, my throat is just itchy or scratchy and I just can't quite clear that itch. And it can also cause symptoms in the chest. So you can have trouble with your breathing. Now that goes into having asthma symptoms. Some people have asthma symptoms, and we can talk about that later, but like some people have asthma symptoms that are triggered by their allergies. And so during that quote allergy season for them, what they start to experience is they're coughing and it's coming from their chest, or they just feel like their chest is congested, like there's mucus in their chest that they just want to clear out, or they start to wheeze, or the chest gets tight, or they start to have some difficulty breathing, a little more than usual. They feel a little short of breath. So those are some of the common symptoms of allergies, but I want to mention one more. So like, there are people who feel the symptoms more in their skin. They just feel like their skin just gets very itchy during the allergy season. And some of them will even show an eczema type of rash. And it's not necessarily the allergies that causes the eczema, but the eczema can flare up during their allergy season. So you can get symptoms in your eyes, in your nose, in your throat, in your chest, and in your skin. And sometimes when it affects the nose and the sinuses, when people feel like they're so stuffy, they feel like they might have a sinus infection, it can also affect their ears and make their ears feel clogged. Like it just feels like there's water in there. Sometimes that's what people describe.
That's a lot. What is happening to the body that is making it react this way? What is the body trying to do?
Right. So it's actually a very fascinating process that's going on in the body. So when people have allergies, what has happened is that their body has somehow developed an allergic antibody to the thing that is the common thing in the environment. So let's take pollen, since it's pollen season. Pollen is like the biggest cause of seasonal allergies. And so if you're allergic to a specific pollen, your body makes an allergic antibody to that pollen. And when you're exposed to that pollen, your body starts to react by causing an inflammation process. And with inflammation, the body, inside the body, we're releasing some chemicals, things like histamine. So that's how some of those medicines that over the counter can help. They help to block the things that are being released by the body. And so it releases some chemicals. It also releases like more fluid. Your allergy cells in your body just get more active because they're trying to clear this thing, but this thing is a normal thing. And so it just continues to cycle. That process just continues, and the symptoms just continue as a result of that allergic inflammation in the body.
That's amazing. We spoke earlier about testing. Kind of walk me through how seasonal allergy testing is done.
Sure. So the most common type of allergy test that you would get if you're concerned about seasonal testing is a skin test. There are other types of tests that can be done, like there's a blood test that can also be done. But for most people, you will get an allergy skin test. And the skin test is a skin prick test, we call it. Some people call it a scratch test because it really feels more like there's a little scratch that's done to the skin. But what we do is we have the allergens, the things that we're testing for. We call them the allergens. So like the pollen is an allergen. For some people, it's like their pet that they might be concerned about, they're allergic to. That is an allergen. All those allergens come in a liquid solution. And this liquid solution is what we actually will prick to the skin. So it's really just pricked or scratched on the surface of the skin. And if you're allergic to that thing that is placed on your skin, within 15 minutes, we will see a reaction that looks like a mosquito bite. That's really what we're looking for. It'll look like a mosquito bite. If everyone knows what a little insect or mosquito bite looks like, there's the center of it feels like a bump, first of all, when you touch it, and the center of it is raised. And if you look around it, there's some redness around it. That's what it looks like when you have a positive skin test. And that's what we're looking for. The people who show up with that type of a reaction within 15 minutes are the people who truly have an allergy to that thing. But a lot of people will show up with a negative. And if it shows as negative, then it means that you're not allergic to that thing. Now, we test for a lot of things. We test for various pollens, which include trees, grasses, weeds. We test for animal dander, like common pets like cats and dogs. We test for dust mites. We test for modes. And when I said that earlier, that pollens are the most common cause of seasonal allergies, the reason I said that is because modes can also cause seasonal allergies. So pollen and mode tend to cause seasonal problems, but the pollens are the most common cause of the seasonal allergy symptoms.
So I was thinking back about what you were saying regarding additional reactions, how some allergies may initially trigger the kind of feeling in the sinuses, but then it may develop into, for some people, asthma. And I know my mother has that, but also, I have grass and tree pollen allergies. My father did, his father did, and now my daughter does. Maybe I should have had a boy, but but can it be hereditary?
Yes, it often is hereditary. That is that genetic part of it that we talk about when I said that it's a combination of genetics and environment that seems to cause allergies, but the genetic part is a very strong part of it. So if you have one family member, as in the sense that an immediate family member, such as a parent or a sibling or a child that has allergies, then there's an increased chance that that person might also have allergies at some point.
Are they dangerous or even perhaps deadly?
So seasonal allergies are rarely ever deadly. The truth is, allergies affects your quality of life a lot. So it just makes people miserable. But seasonal allergies they have a very, very low likelihood of ever making you think that you're going to die from having allergies.
I don't know. There have been times, when you're lying on your back, holding a cloth over your face and holding your nose and just saying, "Lord, help me, please."
Right. And like that, I mean, that's the misery that it causes, of course. Now, some of the environmental allergens can be deadly though. So for example, some people are very severely allergic to animals. And if it triggers severe asthma symptoms, it can become life-threatening. So that's the part, I think, like you can probably see, like I'm trying to not say that, no, there is no chance that it will ever do that, because there is a chance that if you have severe asthma that is uncontrolled and you're exposed to something that you're allergic to in the environment, that you can actually have a life-threatening asthma attack. That's the one way that I can see it become that severe, that it becomes life-threatening. And the times when I've heard or seen people who reported that they had such symptoms, it tends to be people who have asthma that can easily be triggered by an environmental allergen, and the animals seem to be the ones that do it the most. So it's very important, actually, that if you've ever been diagnosed with asthma, or you have some of those symptoms that I mentioned earlier that make up asthma symptoms, that you make sure that you get that evaluated by a doctor and get it under control, because it's when asthma is not well controlled, that's when you see people have reactions that can be life-threatening.
I was also thinking the other thing when you're talking about, animals, or in this case, bees, insects, bee stings. I do know that, there are some people who have very serious reactions to bee stings, and that could, in some senses, be seasonal, because now is the time when you would also see them.
You're very correct, actually. I mean, of course, during the spring, the warmer seasons, that's when we have more exposure to stinging insects, bee stings and wasps and yellow jackets. Those can definitely be fatal. And so if anyone has a reaction to a bee sting that goes beyond just where you got this sting, if you start to have respiratory symptoms, meaning trouble with your breathing, or if you start to have difficulty with swallowing, or you feel like your throat is getting tight, or you feel like you're going to pass out, those are things that you really should not take lightly. You should get evaluated for those types of symptoms.
Let's talk about the various and sundry types of treatment. How are they treated? What's the kind of first line of defense?
So now, in terms of treatment for allergies, we think about the things that you can do to reduce your exposure. So the best treatment would be to completely avoid the thing that you're allergic to. But we all know that it's very difficult to avoid the things we're allergic to, because they're all in our environment, like pollen. Pollen's outside. All you have to do is just step outside and you're exposed to it. But there are some things that you can still do, though, to reduce your exposure to it. And so something like wearing a mask, if you know that you're very allergic to pollen, you can wear a mask when you're outdoors during that high pollen season, whatever it is for you. Some people are more allergic to the pollens that come out in the spring, which are the trees. Some people are more allergic to the pollens that come out in the latter part of the spring, and late spring and summer, which are the grasses. And then the weeds come out like in the summer and go into the early part of the fall. And so if you know what season tends to trigger you, it's smart to wear a mask when you're outdoors, because you reduce your inhalation of the pollen, thereby reducing your symptoms. So that's like an easy thing that you can do. And then when you come back home from being outdoors, when you go inside, you can wash your face or wash your hair, just take a bath, take off your clothing and change to clothing that you didn't have outdoors, because the pollen is sitting on our hair, on our lashes, on our clothing, on our skin. And so you just try to get rid of that. Now, having said that, that can only go so far. Some people need medications and other forms of treatment. And now there are lots of treatment available over the counter. But I would caution you, though, like I would say, you should still, when you take over the counter medicines, you should still try to take it under the guidance of a doctor or someone who can tell you what dose to take, so that you don't take an inadequate dose or too much. But in any case, now they're over-the-counter allergy tablets, which are antihistamines. Over-the-counter, those help to reduce allergy symptoms. There are also now nasal sprays and eye drops over-the-counter, which also help to reduce allergy symptoms.
So I want to briefly talk about some of those, over-the-counter ones. We know there's Benadryl, there's Zyrtec. There's, do they all do the same thing?
So they work differently. So a lot of the over-the-counter antihistamines, they include Benadryl and Zyrtec and Allegra and Xyzal and I feel right. There's one more. So Claritin. These are some of the common ones that you see over the counter. The Benadryl is a short-acting medicine, And so it will relieve your symptoms. And then after a few hours, it wears off. Within like 4 to 6 hours, the effect might wear off. And it also can make people very drowsy. So for a lot of people, they don't seem to tolerate taking Benadryl during the daytime. And then the other ones are longer acting medicines. So they last longer than the Benadryl. They usually will, you might see them over the counter. Some of them will say 24 hours. Most of them will last like anywhere from 12 to 24 hours. And some people notice that one medicine works better for them than another, and they choose whichever one works better for them. But those are your antihistamine pills, and they help to reduce, to act against that histamine release that I mentioned earlier when there's an allergic response in the body. And when they do that, they block the action of the histamine, and so they reduce your symptoms. But sometimes they're not enough, and you need like a nasal steroid spray. A common one that people might see over the counter is Flonase. Others are like Nasonex and Nasacort. Those work a little bit more broadly. So they work not just on the histamine effect, but they work beyond that to help to reduce some of the symptoms that people feel in their nose. And then there are eye drops, allergy eye drops, which most of them are antihistamines, which help to reduce the histamine effect in the eyes, which causes the itching and the swelling and the watery eyes. So they work in different ways, but towards the same goal.
I'm sorry, go ahead, please.
Oh, I was going to say, and then beyond the medicines, there is allergy shots that are available. And there are other, so there's the immunotherapy, we call it, which can be given in the form of shots. And then there are some FDA approved immunotherapy tablets that can be given. And those immunotherapy treatments are the ones that get closer to the root of where your symptoms are coming from. What they do is they try to reduce the body's sensitivity to the things that trigger your allergy symptoms. And in doing that, you're less likely to react with the same severity as you did when you were not receiving the immunotherapy treatment. So really, immunotherapy is probably the best treatment that we have for allergies. It just requires a lot of your commitment to the treatment course, because it's a treatment that you have to stay on for. It's recommended that people stay on for 3 to 5 years. And of course, you have to work with an allergist to try to get that treatment going in the right way.
Real quick, can you outgrow an allergy or develop one later in life?
Yes, and yes. So you can outgrow an allergy. And when people outgrow an allergy, for some people, they actually stop being allergic to that thing that would previously trigger them. But for some people, your body does not necessarily lose the allergic antibodies that you've made to it. You just become less sensitive to it. So, but the end result is either way, you're not having symptoms the way you used to. And so that's when we say someone has practically outgrown their allergy. And yes, you can develop you can develop new allergies later on in life. It used to be that the myth was you start off allergic as a child and then you grow old and you don't have allergies anymore. No, that's not true. You can actually develop your allergy symptoms can start later on in life.
Gosh, that's a lot.
It is a lot. Now, I wanted to mention one thing now, because I really was focusing on seasonal allergies and environmental allergens. We didn't really talk about food allergies, but just to mention that food allergies can be life-threatening. So I want people to know that food allergies can actually be fatal. And so if someone's allergic to a food, make sure that you're working with an allergist to manage that allergy and follow your doctor's guidance.
Dr. Nkirika Erikosima, thank you so very, very much. You've been very informative and very helpful. And we'll come back and talk more about those food allergies at a later date. Thank you again so very much.
Sure, it's a pleasure.
This has been a truncated edition of the Daily Drum for this Thursday, April 3rd. And don't forget, you can hear this in every edition of the Daily Drum Insight segment via podcast on WHUR.com. The original Quiet Storm with Raheem Devon is next on WHUR. I'm Harold Fisher.